So I'll just show you a case and we'll interpret how things are, and that will make things, understanding things much better. Okay. This is a 57-year-old gentleman who had a fall off a ladder, diabetic and hypertensive. He had significant swelling around the knee and it's a closed injury. Okay. So typical history of what will happen in any other ankle fracture. So you'll start suspecting that he has some sort of an ankle fracture. And when you get an X-ray, it confirms that he has the so-called bimallar or trimallar fracture. Okay, so what do we see? We see a big fracture line vertical on the medial malleus. We see a wedge fracture of the lateral malleus, and we see a big posteromallar fracture. Okay. But so when this thing we see, we think that this is okay, a trimallar fracture, and start thinking the treatment. But if we take a step back and see what does this fit into? Now, this doesn't fit into any types of log answers. Why is that? Because the moment we see a vertical medial malleus, it has to be a supination adduction injury, right? And in supination adduction injury, the fracture pattern in the lateral malleus should be infrasyndesmotic, whereas we are seeing a syndesmotic level of a fracture of lateral malleus. So this can't be supination adduction. And it can't be any other fracture pattern because of the vertical medial malleus, right? Because if we have a syndesmotic level of fracture of the lateral malleus, then it has to be either a supination external rotation or a pronation abduction. Now, in both of these, the medial malleus fracture is a horizontal or an oblique fracture, a pull-out fracture, but it is not a vertical medial malleus fracture, right? So this is what is a different entity. Now, why is this important? We'll learn a little later, but we need to understand this fracture pattern, which is different. Now, mind you, all posterior pilon fractures need not have these type of lateral malleus injuries. Okay, you may still get a posterior pilon with infrasyndesmotic type of a fracture. So do not get confused. And how do we recognize also we will learn. Okay. But for now, in this example, we realize that this is not a typical ankle fracture, doesn't fit into any of the classical log and patterns. So this is a little different entity. Okay. When you get a CT, we realize one thing, that there's a huge posteromallar. Mind you, when you're talking of posteromallar fractures in a ankle injury, in a bi or a trimallar fracture, these are pull-out injuries because of PITFL. So you will get a much shallower fracture, something of that sort. But here we are seeing the nearly the half of the posteromallar getting involved. Okay. On the axial cuts, we see that the posterolateral is involved, the posteromedial also is involved, and we have the medial mallar which is fractured, right? So if we consider that as half, we have the anterior and the posterior half. The fracture line is nearly taken half of the posterior side backwards. Okay. So again, if you look into the CT, so this is what it is. There is some combination, but more importantly, what we see is that there are some impacted fragments in the near the articular surface, right? Committed fragments. Now that is also crucially important because now we need to be able to tackle those fragments. Okay, so we need to plan a surgery in such a way that we're able to take care of the fragments. Now, most of the surgical approaches that we know of for posteromallar, like posterolateral approach, we are just buttressing the fragment, considering that these are pull-out injuries and it's a apical fragment, triangular apical fragment, and we just buttress it. But now, with a comminuted fragment, we need to take care of that. All right, so that's the other CT cuts for understanding. We see one big fragment there between the two major fractures, fractured bones. And this is the other cuts for understanding. So as we go posterior, we see that there are two quite a big impacted fragments which are lying loose. Okay. So this is again the 3D CT, which shows us a nice involvement of the entire posterior thing, including the posterior malleus, posteromedial and posterolateral, going on to the anterior part of the medial malleus. Okay. So what I was talking of is these fragments. right? Separate fragments which are usually not seen in ankle injuries. Now, that is exactly how this particular fracture is different from a malleolar fracture. When you're talking of a malleolar fracture, okay, by try whatever malleolar, the typical long answers fracture, these are because of rotational forces. Whereas posterior pilon fractures are because of axial compression. Okay, the talus goes and hits against the posterior malleus and fractures it. Usually we have the anterior pilon. When the foot is in significant amount of plantar flexion and the forces are directed more posteriorly, we can have these particular fractures. So little rare to have these injuries, but we need to identify this. Okay. Now, why we need to identify is, now imagine we do not understand this fracture pattern and take the typical approach that we take for ankle injuries, which is the posterolateral approach. So once we are here, we will not be able to tackle these fragments, right? Number one, that's one thing. Second thing, once we put a buttress and fix the posterolateral to the main fragment, putting back these posteromedial becomes difficult. The medial malleus also taking it back becomes a little difficult. Okay. So we need to find a way that we can go into this in that particular, you can use the fracture, go into the fracture, visualize these fragments, take care of these fragments. Then as second step, we need to put this back and then put a buttress at the back. That's how we need to be able to take care of this ideally. And that's how this particular fracture is a little different. Okay. Exactly what I was talking of. There are fractured small fragments. If we go from the back, there's no way we can tackle it. We need to be able to go from the side. Okay. Because you see this, if you are going from the back, we will only be able to reach up to there. We cannot see the articular surface and we cannot see the impacted fragments which are lying within the fracture. Right. So unlike, now you compare that injury that we have against this patient who is a very similar history, similar age group patient. This is a typical example of a trimallar fracture where we have a pull-out fracture of the medial malleus, an oblique fracture at the syndesmotic level of the lateral malleus, and a posterior malleus triangular fracture, all right, but the width is much, much lesser as compared to what we had in the previous case, which was nearly half of the posterior malleus. Okay. So this particular example is typical of a trimallar injury. Now, in this case, if you want to do a Logan's classification, this will be a supination external rotation. Okay. And then the treatment is classical that you can go in posterolateral, fix the posterior malleus and the lateral malleus with an antiglide, and then fix the medial malleus. So that is the typical way we do, but the similar looking fracture pattern, the treatment will completely change the moment it is a posterior pilon injury because we need to take care of those fragments. So this is what I was talking about. Now this is a posterior trimallar fracture shown in the previous X-ray, in which we see a clean fracture line. There are no separate fragments there. So all we need to do is go and buttress it from the back. So we can use a buttress plate. So that will take care of the posterolateral. The same way you can take care of the lateral malleus with an antiglide and then the medial malleus. Okay, this is for the trimalleolar. So we see posterior malleus being fixed, antiglide for lateral malleus and the medial malleus. This is how we will do regular, right? So posterior pilon, if we have recognized now it's a different entity. And what is the typical definition? Now this is a free access article for everyone. You could take a snapshot of this. It's there in Medicine 2019, right? And they have described this particular injury very nicely and made us understand things much better. So you could download this and have a look whenever you get some free time. Okay. The definition is whenever the posterior malleus fractures involves the posterior colliculus of the medial malleus. Now, mind you,